today about just assessing the readiness of a runner, and in general, but also in particular after injury. But I thought I'd, in the context of this topic, focus on two of the more stubborn injuries I see in adolescents in particular. And that's the patellofemoral pain syndrome, which is much more common in females, and then the pulled hamstring. More common in the sprinters, of course, but you definitely see it in the distance runners who are doing, interval workouts and that sort of thing. Running dehydrated, whatever, it ends up pulling their hamstring. So talk about the first thing, the patellofemoral pain syndrome, and it's got that name because we don't know what's causing the pain. As syndrome means, it's just a series of symptoms that a patient has, and so we don't know exactly what's going on, but we call it a syndrome. And it basically is just pain behind the kneecap. And in an adolescent female, if you're my age or Bill's age and you have pain behind the kneecap, you probably have some articular cartilage damage, right? There's probably some arthritis in there, right behind the kneecap. Hey, Matt, can you dim this one light? It's like right in my face. Can hardly, I don't know if you have access to that, but anyways, a little better. But in the female, in adolescence, there's not going to be any articular cartilage damage, but they can have some significant pain behind there. And usually it's related to some biomechanical problem. So the patella, obviously, as you all know, it's pretty free-floating in there. And the reason it's more common in females is because they tend to be more mobile. So if you have more mobility, it's harder to stabilize or keep that patella tracking right down the middle of the groove that it's made for. And then there's some design, individual athlete design, that can make you more susceptible to that tracking. And it usually tracks, I've been doing this for 35 years, and it always seems to track toward the outside if it's not tracking right. I think there can be some rare occasions where it goes the other way. But the most common, one of the most common is, do you guys know Q angle? You heard what that is? So if they're just standing resting, it's the angle between the hip and then the knee, where the quads attach. So that's called the Q angle. The bigger this Q angle, the worse problem you're going to have with your patellofemoral joints, because you can just picture how that kneecap's just going to get pulled to the outside. And you probably have seen some people, these poor and it's always girls for some reason, that some guys once in a while, but they got this big Q angle. And it's just, when it's structural like that, it's very difficult to treat. We do everything we can, and we'll talk about treatment for it, but that's one. Some people are designed with a shallow groove for the patella, so it's supposed to be this nice 30, 45 degree angle like this where it glides. Some people, the groove is like this, and then it just slops around in there, prone to riding up on the ridge of the femur, and then it can rub a little bit, and it doesn't like that, so it produces pain. Anteverted hips, that causes a big Q angle, and so anteversion is when the angle of the femur is too far anterior. So then the athlete will walk. That's that person who's walking toed in like this. They will try to straighten their toes out, but when they do that, they're walking like I'm walking like this. Okay, so if you see somebody naturally toeing in, and sometimes parents, don't really know better, and they try to teach their kids when they're growing up, they got to force their feet forward, but that causes biomechanical problems, because now if I walk like this or try to run like this, that's going to create some issues. So anteversion is another structural thing that can lead to some patellofemoral issues. And they're the ones also that have a ton. They'll sit. You'll see them sitting on the field like this with their, in that W sit they call it, because they have a ton of hip motion in that direction. A very fixable problem, weakness in the gluteals, can lead to patellofemoral problems. And then overpronation, somebody with a real floppy foot, they're hypermobile, and when they hit the ground, everything just collapses like this. So that can lead to patellofemoral problems. So you get control from the landing. The glutes do most of the neuromuscular control, but the foot has to be doing some stuff too. It's contributing. So if it's real floppy down there, a little extra support underneath can help. All right, so if somebody has a large Q angle, what we can do to try to correct that, if you see an athlete that tends to be like that, they just need extra strong glutes, extra strong feet. So there's this concept of the structural Q angle, and then there's the effective Q angle. So I could have a perfectly normal 15-degree Q angle here structurally, but when I hit the ground, everything collapses like this. So now I have this huge effective Q angle that's really messing up my patellofemoral joint. So if you have a structural large Q angle that's going to make you prone to that, they just need just powerhouse, the deep rotators of the hip. I know clams are probably part of your regular routine, but that person probably needs to go heavy on clams, like really beef up their deep rotators, squats and lunges. And if they're having issues and you guys are working with a strength coach or whatever, get them to really beef up the glutes. But then the foot and ankle complex plays a huge role. You may have to put a little extra arch inside the shoe for their distance running, for their high mileage stuff, to help take some of that off, or get them running barefoot and do crazy intrinsic strengthening. And that combination can help, depending on how big the natural Q angle is. If you guys have any questions, just interrupt me along the way. So shallow, if you have a real shallow groove, the same thing applies, extra strong in the glutes and foot and ankle complex. But you might need some bracing if it's real unstable. And so that taping technique, you can Google it, YouTube options. Most of the trainers in your school will know how to do this. It's just Jenny McConnell from Australia came up with this taping technique that really helps. You're just changing the pattern of loading just a little bit by pulling that patella over. And it's a pretty simple taping technique. If you put a sleeve over top of it, it'll tend to stay in place a little better when it's hot and you're sweaty and that sort of thing. And then if that really works, I'll recommend people get the True Pull brace. And I haven't seen anything. Amazon's got a knockoff that looks just like it, but that's probably the best brace. It's low profile, and it has this J pad, and you can just actually crank it over, and it can work really well for this person who's got that unstable, shallow groove. And it doesn't take up, it's not so heavy that it disrupts their running mechanics or anything like that. And then, of course, trying to fix it from the ground up a little bit. Less is more when it comes to orthotics. You want to suggest, hey, try the light ones, and if that doesn't work, go a little heavier. And then the gluteal strengthening. And we do a lot of what we call kinetic chain rehab. So I'll try to take the running landing position, and we're just doing strengthening in that position. I might be given a cue, a force. I'll be pushing against this leg, and they're having to engage to resist that. A lot of foot and ankle neutral, get the short foot strengthening, doing hops, working on that control with the mirror feedback. So it's working on this whole kinetic chain, including the core and the obliques. And if we can just make them extra strong in the landing and controlling the sagittal plane when they land, you can really help folks with this problem, stubborn problem. So I'm going to talk about hamstring. Any questions on patellofemoral? Talk about hamstring, and I brought this up because it's near and dear to my heart. I just overcame a hamstring strain. Well, I think I've overcome it. I haven't tried actual sprinting yet. So, the causes usually fatigue, overworking, not ready for what they're doing. Um, they didn't prepare during the summer, and then they're doing speed workouts too soon for them. And tightness, the young men who are growing like crazy, their hamstrings are super tight. And then, you try to open it up, trying to get them to get that big stride angle, and then they can end up pulling if they're not careful. Weakness, poor conditioning, and of course insufficient recovery. If you're tight from the day before's workout, you're going to be more prone to pulling your hamstring on the next day. Anybody know what part of the gait cycle the hamstring tends to go? Is it the beginning, like when you're pulling up here? Is it when you land? Or UVA has this really cool video I got to see. Cool, not cool for the athlete. They have this 25-mile-an-hour treadmill. So they had this guy doing sprints on it, and they had him all wired up with EMGs and 12 cameras, and they're analyzing it. And he rips his hamstring, and they got the exact moment and all this data on when the hamstring went. We've always known it's at the end of the swing cycle. So the hamstring is most active from mid-swing to terminal swing, slowing the leg down, and then it's got to change from an eccentric contraction to a powerful concentric. And that transition period is when that hamstring tends to go. And it was pretty cool that they had it, actually caught it on film. And you should have seen that guy stumbling and going on a treadmill 25 miles an hour with his hamstring shot. Anyways, so when we retrain the hamstring, try to get it back, we've got to work in this zone. Okay, so doing, strengthening, RDL, stuff like that, you got to make sure we work in that zone of end range, work eccentrically, and we got to work with speed, because the hamstring is working at a very fast, when that leg is swinging through and it's got to contract and pull it back, it's very fast contraction. So on any muscle strain, I can't emphasize enough the importance of active rest. So, and that's true for stress fractures, tendinopathies, any of you kids. They go to the doctor and the doctor says rest. But that means don't run because it hurts to run. But they could ride a bike, they could swim, get these kids, maybe you got to get clearance. But I've had so many kids come in, the doctor said don't do anything. It's like, oh my gosh, you just lost 2 weeks of training, But they can be biking, they can be doing a lot of stuff that's very safe for the injury. And, have the parents ask specifically, can I do da-da-da-da-da. Usually movement, we heal so much better. Even an acute hamstring, you might need to give it a couple days to get through that acute phase, but then get them on a bike and just spinning it out. An elliptical machine at a low level. You want that active rest. Speeds up a muscle strain super fast, getting that blood flowing. With any kind of muscle pull, stretching is not recommended until later stages. It needs to kind of mend. If you just keep cranking on it and stretching it, you'll just stretch out the young tissue that's trying to heal there. So these are a couple examples of some strengthening exercises that we do that emphasize eccentric. You can start with isometric. The bridge is kind of an isometric hamstring. I mean, it's working the hip into extension, but there's not a lot of movement. So early on, that tends to be a pretty safe exercise there. And then a progression of that is to have them curl it in. You guys probably know this. And then it's that slow eccentric back out, and then down and up, slow eccentric back down. Yes, sir? Eventually, you can do focus on eccentric, where when later stages, you can get them up on two, curl it in, and then lift one leg and have them just focus on the eccentric one-legged. That's a really good thing to do, but that's obviously later stages. And then the RDL, I think that's the best late stage rehab, because it is making the hamstring do what it has to do when you sprint. So it's taking it to end range, And then I always like to emphasize that little quick kind of return. Slow down, eccentric, boom, pop back up. And it's this quick, try to mimic that change eccentric and then change of direction. So RDLs and high hamstrings eventually need to get up doing RDLs, but those are very late stage because it stretches a lot. But excellent, I think, and one of the tests, well, we'll talk about that, but RDLs are a good way to test to see if you're symmetrical. So you can have them do one-legged RDLs on one side and on the other, and keep adding weight and see if it's comparable in strength to the opposite side. The biggest mistake with hamstrings, you guys have seen it, recurrent strain, recurrent. Again, it feels great. They go through rehab, they're running, they're doing 400s, everything's looking good, and then they go in a meet and then they rip it again. And that happens, I've seen it so many times, and football players too, field athletes. The problem is they just never took it to that nth degree in rehab. And that's what you got to do to prevent it from happening again. This is one of our strength coaches who's got ridiculous strength. So, what's that? Yes. Yep. If Romanian does, Nordic curls are one of your go-tos. Good. That's good. That is, if you want to train your kids during strength time, sprinters in particular, but distance runners should start assisted. They could do it against a band or with a partner, with the goal of being able to achieve all the way down. Yeah, that if you can do that, you're probably never going to pull a hamstring. But that's kind of the gold standard for late stage and strong bulletproof hamstrings. So dynamic mobility is important too. So we talked about how much flexibility you need to get out here, and it's got to be, flexible and fast. So when we're early stages, when we're stretching, I don't even like using the word stretch. It's mobility. I'm on my back, I'm holding it like this, and I'm using my quad to generate the movement to give me that little bit of mobility out of the hamstring. So the body's really smart. If you let your quad do be the force to stretch the hamstring, it's not going to hurt itself. It's like the hamstring will give a signal saying, "Hey, shut down! Don't go any further." You know what I mean? But if you use your whole body to bend over, or if you get a partner to push your leg up, there's a chance you might overdo it. But I like the active. It's kind of a safe way to start getting some mobility. Usually go just a couple seconds at a time, and to start lengthening out that injured tissue. Later stages, I couldn't find an athlete doing the German march or whatever you want to call those, so that was the only image I could come up with. But you get the idea. That's great. You guys use that, right? That's part of warm-up, dynamic hamstring mobility. They later stages, these athletes, the ones who've been injured, they've got to be able to do that, and they got to be able to do it pretty fast. And our coach calls these prime times. Do you all use this drill where it's straight leg, you're running across the field like that? Other really good dynamic later stage hamstring work for an injured, but also for prevention. You really get those legs going quickly across the field. And this is one of our, we like mid-stage, we'll start working this to get speed, because the hamstring quickness, so it's got to be strong eccentrically, but it also has to be able to fire very rapidly. And so this is one of our favorite exercises to mimic that. So we'll go for like 10 seconds and just tell them go absolutely as hard as they can, and that will toast you. They do like 5 reps for 10 seconds, and they're done. Really good, quick speed, high speed hamstring exercise to try to get them to that next level. And then, all of this we can do in the gym, but nothing stresses and trains a hamstring for running like running, right? So obviously you got to start running as early as possible. As soon as they could start jogging, I let them jog, even if it's just 2 weeks post, and then gradually increase intensity. So you have to build the load tolerance super gradual. The hamstring, all you have to do is tip it over the edge a little bit, and boom, you're back to square one. It's so frustrating. And I don't know why the hamstring in particular tends to be that way. But I like this concept here. I don't know if you guys have ever used that for an athlete coming back. But it's a real gradual progressive acceleration. So you pick maybe 50, could be 100. And they start out real slowly, and they gradually accelerate more, gradually a little bit more. And you can do that up to about 50% of max. So they're not going all out right from the get-go. You see what I'm saying? So that's a great way. The progressive acceleration is a great way to get them to that peak level over a longer period of time, and then gradually increase the intensity. And you start with really short for high intensity, and then going for the distance that their goal is. It's all about this building load tolerance. That's the concept you got to think of. Load tolerance from a strength standpoint and from a speed standpoint. So when is the hamstring ready? You got to have equal strength, and flexibility. So you lie them down on the ground, take their leg up, put the other leg up. They got to be equal, okay? Strength, I like to use RDLs, but I'll also use a handheld dynamometer. It's just this little force gauge. I can have them push up into me or curl into me, and I can compare left to right and see how close they are. So you got to have equal strength and flexibility. This active knee extension test, it's pretty aggressive. You literally are lying on the ground, and you have them do 4 reps of real fast, bringing their legs straight up like that. You compare one side to the other. They should be able to do 4 reps rapidly with no discomfort whatsoever. You pick it as it's got some guy's name, Axelson or something, the active straight leg raise test. That's one of the tests we'll use it's a little more, it's pretty aggressive for a clinical test, but obviously a lot less aggressive than actual sprinting. So it's a way to see how close is it to ready. So we have to pass these clinical tests of strength, mobility, and then the active knee extension test, and then start increasing sprinting from that point. Any questions on hamstring, progressive loading? So I think I talked about this last year. Blaze Williams was a professor at VCU in Richmond. Now he's with Nike, I believe. But he put together this running readiness scale. It's a great little test you could use at the beginning of the fall for cross-country runners, seeing just how, did they really prepare themselves for the summertime. It's been found to be reliable for sure. And validity, they're still trying to do some validity tests, but they found if you scored under there was one research study, if you scored under a 3, you were more prone to knee injuries in high school cross-country runners. So that was one of the validity tests they found it to be pretty valid, since it compared to injury rates. But obviously you want a 5 out of 5. There's 5 tests, and if you pass it, you get a point. If you fail, you get a 0. And it's pretty challenging. You guys should try it yourselves. The hopping is just ankle pops like that, 60 seconds. Got to do a plank for 60 seconds with no collapse of the core. The step-ups are at a very specific rate, up, down, and halfway through the minute they switch legs and just go up and down. And then the single leg mini squat, same thing. It's on a cadence. It's click, click, 180. cadence down, up, and they should be able to do it with good core control and just up and down like that 30 times. It only has to be about a 45-degree angle because that's all you really need for the landing part of running. So just up and down like that. And then the parallel wall for 60 seconds. So great, easy thing to run the kids through. And if they failed, if the most difficult one is the single leg squat, that shows core control and that sort of thing. So if they're failing, you can make that part of a exercise routine to work on it, kind of training for the test. All right, and then after injury, if you have, now in PT we do this, we've got this psychological readiness scale, and there's several of them out there you can find. But if you're not sure that they've gone through that, or if they're still feeling a little shaky about returning, the athlete's mental part of the confidence in the leg is important. So there's several scales out there that have been found to be valid. And you can find, it's just a questionnaire about, are they fearful of re-injury? Are they, how do they feel during the day? Blah, blah, blah. So it's all about that psychological readiness, and that's an important piece. If you're not psychologically ready, you're again going to be more prone to some type of injury and maybe re-injuring the same thing. In course, we do in the PT clinic, we'll do, and if you're in a college setting, you probably have access to this. We got the biomechanical assessment, looking at running mechanics, those other factors that could have led to the said injury. So that's an important part, later stages. Let's get to the biomechanics and say, okay, while we're getting you back to running gradually, let's work on those mechanical things that could be contributing in your running form. And then, of course, once they get back, stay in touch with them. Make sure they're giving you feedback. It's a fine balance between, trying to get a kid to not be neurotic. Like some athletes are real neurotic about their injury and they overthink about it. So you got to treat them a little differently. But most of them, they want to get back. You just got to stay in touch with them. And if they start feeling any tightness, any warning signs, the earlier you catch that, the better to prevent re-injury. So, any questions about that? That's all I had on that. We can pick up the shoe discussion some more if we want, or talk about anything else that you all want to talk about. No, water, like the deep well running and stuff like that. Yeah, there's protocols out there that work really well for that. When I talked about cross training, getting the deep well, I mentioned swimming, but of course, deep well running. Oh yeah, I think that's fantastic. There was a gal, I don't remember her name. She ran for Stan Morgan, and it was the top distance runner in the state, and she had recurrent shin stress fractures, and all week she would be in the pool. I think she did track workouts and she did races, but the rest of the time she was basically doing deep well running and very, very low mileage, and she won states, cross country, training just primarily in the water. She went to UVA and was running for them, and unfortunately they didn't. What's that? No, that's not the name. This was a long time ago. This goes back maybe 15, 20 years. I just remember it really stands out. She ended up, I think, getting off the team because she just kept having trouble with the stress injuries. I think if they had worked with her and let her do like a 3-day-a-week run routine and cross-train, she probably could have done quite well. But anyways, any other, yes, sir? They're banning the carbon? makes sense to me. I mean, maybe just for track workouts and racing, and limit it like that. Back on the shoes who've been around for a while, or Jeff, maybe you can answer this.